Rest and rest seat. For the definition, the rest is any component of a partial dentures on a tooth surface that provide vertical support. And the rest seat is the prepared surface of abutment tooth to receive the rest. So remember in the first lectures, I talked about the component of the removable partial dentures. I said the rest is on femur. The rest seat is on the tooth. Those two terms should not be confused or misused. So what's the purpose to the rest and the rest seat? So they can provide the vertical support of the partial dentures. And also they can maintain a component in their plant position. And because they maintain the component in the plant position, so you also establish a occlusal relationship for preventing selling of the dentures. You also can prevent the partial dentures impingement to the soft tissue. The last important purpose is to direct and distribute occlusal load to the abutment tooth. So one of the most important characteristic or the purpose of a rest and rest seat is to transmit the vertical force to the abutment tooth and direct those force along the long axis of the tooth. The reason why the tooth can resist by the vertical force is because they have PDL, and the PDL can resolve and transmit those force from the tooth to the velar ridge. So the rest and rest seat should be rigid, and they should have a stable contact between the rest and rest seat to prevent independent movement. Also, the rest seat position should be only on the sound enamel, because the enamel is the strongest part of the tooth, can resist the fracture and the distortions. First, let's take a look for the occlusal rest seat. So the occlusal rest seat, the outline form is a rounded triangular shape with the apex toward the center of the occlusal surface. And when we talk about the dimensions, one textbook said as long as is white and the base of a triangular shape should be at least 2.5 millimeters for both molar and premolar. So in this descriptions, it means that the buccolingual or the mesodistal width should be at least 2.5 millimeters. However, the other textbook said due to the different size of the tooth, then they would suggest to use the facial lingual width as a guide. So you should have 1/3 of the facial lingual width of the tooth. Or if you use a cusp tip, then it will be 1/2 the width from the tip to buccal to the lingual cusp tip. Also, we have to have a reduction of a marginal ridge of approximately 1.5 millimeters. Remember when we talk about the major connector and minor connector, I said on the junctions of the rest seat to the minor connector, those width thickness should be 1.5 millimeters to provide the sufficient strength for the minor connectors. So you should remember that once you finish your preparations on the marginal ridge reductions, at least need 1.5 millimeters. When we do a cross sections, the occlusal rest seat form, actually the floor of the occlusal rest seat will be apical to the marginal ridge and occlusal surface. So the cross sections image will look like a concave, or what we call the spoon shape. When we connected the occlusal rest to the vertical minor connectors, we can create the angle. Those angles should be less than 90 degrees. The reason is this angulations can be sure the occlusal forces can be directly to the long axis of the abutment tooth. However, if this angle is more than 90 degrees, it will just look like the slides pictures. So you will have two sliding surfaces. When we have a sliding surface, when the occlusal rest got the force, that will have a horizontal sliding. Means that you will provide the horizontal movement to the tooth, which is hurting the tooth. So when we finish the occlusal rest preparations, the occlusal rest just provide occlusal support. They shouldn't be expected or be provided any stabilizations against the horizontal movement. Those stabilizations should be provided by the other components, kind of like direct retainers, but not the occlusal rest. So if you look at these pictures, after you finish, it will look like a ball, actually, and you will feel it was smooth and use no undercut over the resi preparations. So when you have a most posterior abutment is mesial tilt molar, then you might need to use what we call extended occlusal resi design, which is one of the variations from the normal occlusal rest and resi. This design can minimize further tipping of the abutment and be sure the force can be directly to the long axis of the abutment tooth. So it should be extended more than one half of the mesial distal width of the tooth, which we use only 1/3 mesial distal width for the regular occlusal rest. However, on the buccal lingual width, it still will be around 1/3 from buccal lingual width of the tooth. And for the thickness, you need at least 1 millimeter thickness for the metal. However, when we have a severely mesial tilt abutment tooth, then you might need to use this specific design, which is called ONLAY occlusal rest seat. When we do this design, you have to place a bevel on the buccal and lingual occlusal surface, and also 1 to 2 millimeter guiding implant on the mesial surface abutment. Those specific design can be sure that this ONLAY occlusal rest seat to the rest contact will be stable and to provide the stabilizations. However, we are rarely to use those in the clinic because to consider about the preparations and the framework casting is a very technique sensitive procedure. Also, some people will use this to correct the severe occlusal plane irregularity. Look at the pictures. So if the patients have irregularity of the occlusal planes, as you see on the upper pictures, you either need to make several crowns to be sure that the occlusal plane can be established on the ideal position, or you can use this ONLAY occlusal rest seat to build up the occlusal plane. So eventually, this will be able to save patients more money without doing the crowns. However, like I said, this design sometimes is very technique sensitive and you should be notified before you do this design for the patient. We also have interproximal occlusal rest seat. Remember in the Cin lab I told you that this is kind of like two individual rest seat preparations and combined together. One is on the mesial, one is on the distal. You just only need to notice when you do your preparations, you have to extend it further lingually than the original occlusal rest seat because the minor connector will coming from the lingual part. And so you had to have more space to accommodate the minor connector. Also, you should avoid it to reduce or eliminate the contact point of the abutment tooth. So basically, this resi preparation should be above the contact point. However, the proper interocclusal clearance is still very important, which you use like 1.5 millimeters reductions from the marginal ridge as we discussed in the regular occlusal rest seat as your guidance. Sometimes you might need to do some lingual interproximal areas preparations to prevent the torquing effect on the abutment by the minor connectors. When we move into the anterior teeth, then you might need to use the lingual rest or what we call the CINGULUM rest. This CINGULUM rest shape is a slightly round V shape when you look at from the occlusal surface. And the apex of a V is directly incisally. And when you need to prep the CINGULUM rest, you should use inverted cone shape diamond burr as you practice in the synapse. When you finish your preparations, remember all the line angles should be eliminated and be rounded. And this preparation still will be just in the enamel portions and need to be highly polished. The other important factors after you finish, you should check the predetermined path of placement should be kept when you prep this CINGULUM rest and rest seat. The fall of the rest seat should be toward the CINGULUM rather than the axial wall to provide a proper support. When you finish, you should be noticed that you shouldn't have any enamel undercut on the facial part, which will interfere your RPD placement. The mesial-distal length of this preparation should be at least 2.5 to 3 mm and be limited between the marginal ridge. The labial lingual width will be 2 mm and the incisal apical depth will be 1.5 mm as a minimum. However, when you do a depth, you still want to limit it just only on the enamel portion, not to the dentin portion. So this CINGULUM rest seat design is primarily used for the maxillary canine because the maxillary canine morphology used to permit these preparations with the minimum tooth reductions. However, on the mandibular canine, sometimes the thickness of the enamel is limited, so you will not be allowed to use the lingual or the CINGULUM rest seat. So you should check the X-ray to verify the thickness of the enamel before you do a rest seat preparations. And sometimes if we are not able to directly prep over the mandibular canines, then what you can do is to do a prepared rest seat in the cast restorations and then cement those cast restorations over the tooth. We also have an incisal rest seat, which is be used for auxiliary rest or as an indirect retainer. However, because this rest seat is over the incisal edge of anterior teeth, so aesthetic is compromised. When we talk about the incisal rest seat, the shape should be rounded notch at the incisal angle of anterior teeth. And when we finish this, those notches should be bevel, both labial and lingually. And when we finish this, the lingual enamel should be polyp shape to accommodate the ridge minor connectors. And for the dimensions, is approximately 2.5 mm width and 1.5 mm depth. Sometimes we use an incisal rest seat if we need to stabilize the anterior teeth, especially incisor. When the anterior teeth have some periodontal issues, have some slight immobilities, then you might want to use the lingual plate with the incisal rest seat, try to stabilize those periodontal involved tooth. However, ideally, you still need to consider if you really want to use those periodontal compromised tooth as your abutment. In the earlier slide, I said we are rarely to use the incisal rest seat because of a static issue. However, consider about the force distributions. Actually, incisal rest seat also not preferable compared to the single rest, because the single rest will be located close to the rotational center of the supporting tooth and will not easier to tip the tooth. However, the incisal rest is more away from the center of rotation, so you might provide a little bit tipping force to the tooth. So if we are doing any cast restorations and trying to create the rest seat, then you might want to use a single rest, not the incisal rest seat. Nowadays, we also can use the implant as a rest because the implant can resist the vertical tissue forward movement. Also, the implants can provide a retentive effect. Nowadays, the most common attachment we use for the implants as a rest is to use the locator abutment. So we already talked about the common rest design, and let's take a look for some rare designs. The first is additive rest seat restoration. So this kind of restoration can be made by the metal like casting chrome cobalt, or also could be made by the porcelain laminate or the composite resin. So it's kind of like to add additional restorations to the lingual surface of anterior tooth, and with those rest seat preparations designed over the restorations. So this is very good for to form the rest seat on the tooth with unacceptable lingual contour. However, because this is the additional restorations, so the cost and the treatment time will be higher than the regular rest seat preparation. Also, we have internal occlusal rest. This is used in the tooth-supported RPD, so it's the clinic class 3 cases with casting retainer on all abutment tooth. It looks a little bit similar like attachment, but it will not be considered to be attachment because this is still only just be the rest, not the direct retainer to provide the retention. And the occlusal support is from the floor of a rest seat, and horizontal stabilizations is provided from the near vertical wall of this type of rest seat. The advantage to use this internal occlusal rest is to facilitate the elimination of a visible clasp arm buckling. Also, it can permit the location of a rest seat in a more favorable position. However, you can see on the picture, so it's kind of like have some specific design over your crown fabrications, so the technique sensitivities and the cost will be higher or more than the regular crowns. So we just finished the common and uncommon rest seat designs, principles, discussions. And this following couple of slides, I just provide you some brief notes of some common rest seat design, so it will be easier to use in clinically. And basically, when you do the rest seat design or preparations, you need to know what type of bird you should use, especially how is the shape it looks like. And finally, you have to control the different dimension requirements, which is very important to provide the function and stabilities for the different rest seat design. And when we do the preparations, the preparation sequence is very important. If you need to prep the occlusal rest and the proximal guiding plan, remember the preparation of the occlusal rest seat always must follow proximal guiding plan preparation, never preceded. So you should do the proximal guiding plan preparations first and then to do occlusal rest seat. The reason is because when you change the proximal tooth surface after you prep the guiding plan, then your location of the occlusal rest seat will be changed. So if you do your occlusal rest seat first and then to create the guiding plan, then your occlusal rest seat dimension actually will be smaller than what you need. Also need to remember, after you prep the tooth, even we just do the enamelplasty, just involve the enamel part, but you still need to provide the fluoride gel applied to the abutment tooth. Try to provide it the protections after the preparation. Sometimes you may need to prep the rest seat on the existing crowns. When we do this procedure, we have to know there have some possibilities that those existing restoration may be perforated while we do a rest seat preparations. When those perforations really happens, sometimes you might able to repair with a composite or the amalgam restorations, but you still have a chance that you need to replace a new crown. So you have to notify the patient before you do this procedure that they might need to have a new crown fabrications after we do a rest seat preparations. It also means that you are asking patient to pay more for their treatment. So you have to be sure patient realize the possibility of the crown perforations. Sometimes you might afraid to perforate the crown, so you prep your rest seat conservatively. However, this is not allowed because when you jeopardize the dimension requirement for the rest seat preparations, those rest seat function will not be fully applicable to your RPD framework. So the best thing is to notify the patient earlier and still follow the original principle to prep the rest seat on the existing crown. Sometimes you may need to do a survey crown. The survey crown is the crown to which follow your design. So when you do the survey crown, you should have your design first. That means that in the clinic, you have to already know where you want to place the occlusal rest, where you want to place your guiding implant, and where is the undercut so you can fabricate the survey crowns. When you do the preparations, the margins requirement is the same as you do the regular crown. So depends on if you want to do a PFM crown or the all metal crowns, then the marginal requirement is the same. However, when you need the occlusal rest seat on the survey crown, the final step when you prep the tooth is to be sure you have enough occlusal clearance. So look at the picture right now. You can see on the right side, on the mesial of this premolar, you can see that they have some depression on the mesial side because they need to provide more room to get the mesial occlusal rest on the crown. And when you check the occlusal clearance, you have to know those occlusal clearance will be needed. The width is the sum of rest seat depth plus the crown material thickness. For example, we already said occlusal rest seat depth is 1.5 millimeters reductions from the margin ridge. And if you want to do a PFM crown with porcelain occlusal, then you will need another 1.5 to 2 millimeters thickness for the porcelain occlusal surface design. It means that when you ask patient to bite down on those specific area, you will need over 3.5 millimeters occlusal reductions. If you are not able to get those occlusal reductions, you are not able to design a rest seat over a all ceramic crowns occlusal surface. So this is very important because sometimes if you don't have enough occlusal clearance, then you will jeopardize either your crown strength or your occlusal rest functions. Sometimes when the tools already have the amalgam restoration and you need to use those kind of area to prep occlusal rest, then you have to realize that this is not an ideal situation. The primary reasons then you want to do this is just for economics, to save the patient's money. Because sometimes patients not able to afford a new crown fabrications fee, so you would do this procedure. However, when you do this kind of procedure, you still need to think about if you're gonna break the tooth, because you're gonna prep over the old restorations and maybe decrease the strength of those material. Also, you have to know the unfavorable flow and poor tensile characteristic of the amalgam is possibly increase the restoration failure. However, in the clinic, sometimes you will still be allowed to do amalgam restorations uh, preparation of the rest seats. So you have to discuss with the faculty of these possibilities. However, nowadays we use more and more composite resin as our restorations material. So if you want to do a resi preparation on composite restorations in the school policies, it is not allowed. The reason is simple, because those composite resins, the strength is not strong enough. So it will provide more possibilities to fracture the material under the occlusal force. So eventually your framework will not easier to fit with the tooth. That's why in the school we are not allow you to do occlusal resi preparations on the composite restorations. Sometimes we may need to replace the definitive restorations under existing RPD. First of all, you have to know this kind of replacement is very difficult and the result probably will not be ideal. For example, if patient have a maxillary RPD and with the tooth number 5 have mesial occlusal rest, when patient have a new caries on tooth number 5, after remove the caries, and the tooth number 5 will need a new restoration. Some patients might ask you if you can do a restorations just to retrofit the existing RPD. It may be happened, but it's very difficult. The ideal situation or ideal treatment plan will still be redo the whole restorations and make a new removable partial dentures to fit the new restorations. That would be the ideal. However, sometimes patients may have some difficulties about the time or the money to do those kind of procedure, so you will be requested to do a replace a definitive restorations under existing RPD. So you have to consider the potential advantage or the disadvantage of those treatment options and really discuss with the patients. In the clinic, when you do this procedure, you have to get approved from the faculties to this kind of procedure.